Hello, my name is Sarah Miller, and I'm a Master's of Occupational Therapy student at Radford University, Carilion, located in Roanoke, Virginia. Today I'm going to be going over a case study that I performed based on a young female named Megan. So Megan was in a multi-vehicle car accident, not wearing a seatbelt, and her diagnosis after that was a right hemiparesis secondary to closed head injury with bifrontal intracerebral hemorrhage and intraventricular hemorrhage. So basically, the right hemiparesis means that the injury was to the left side of her brain and affects the right side of her body. Bifrontal intracerebral hemorrhage is also commonly referred to as a brain attack, where blood vessels burst and the bleeding happens within the brain itself. And since it was bifrontal, that means it occurred in both sides of the frontal lobe. Intraventricular hemorrhage is when bleeding occurs inside the ventricles that hold the spinal fluid in the brain. Alright, so based on an interview that I had with Megan, I found out that her interests include studying and doing well in school, being active in gymnastics, soccer, volleyball, and horseback riding, as well as hanging out with her friends and boyfriend. As for her hopes, she says she would love to be able to take a walk in the park again without getting lost or without a wheelchair or walker. She also states that she wants to get back into horseback riding and to become more independent in self-care activities. But more than anything, she says that she hopes she can get back to school and that she can attend prom with her boyfriend in 3 months without having to bring her walker. As for her occupational profile, I decided to use MoHo. Due to this, Megan's volition and personal causation for treatment is that she wants to get back to being the girl that she was before the accident. She does not want her friends or boyfriend to avoid her due to her physical altercations, and she doesn't want her parents to treat her like a baby. Megan wants to be independent and go back to being involved in soccer, gymnastics, volleyball, and horseback riding. For her habituation, she is used to getting up and getting ready for school, going to after-school practices, and hanging out with her friends and boyfriend. She enjoys her roles as a daughter, friend, girlfriend, teammate, student, and athlete. However, everything was turned upside down to the accident, and her performance skills suffered. She is now emotionally unstable and becomes angry, anxious, upset, and frustrated over the slightest changes and events. She has become impulsive with a lack of safety awareness, has poor balance and coordination, and has difficulty sequencing and remembering more than two-step processes. However, she has become more independent in her wheeled walker and is now able to do most tasks with supervision or only minimal assistance. So due to her circumstances, her strengths are that she does have a lot of support and care from the rehabilitation hospital where she is located. She was also once an active and healthy girl and enjoys physical activities. So based on this, hopefully this can help aid in her recovery since she is already interested in being physical and active. She also has great support from her parents, friends, and boyfriend. And on top of that, she is also now more independent in walking with the wheeled walker, so she is showing some improvements. She is also able to complete most required tasks with minimum assistance or supervision, and she also has great motivation to become independent in walking and other self-care tasks. Now, with every strength, there does happen to be some weaknesses. For example, her parents, even though they are supportive, still try to baby her too much instead of letting her be independent and work towards getting back to doing things by herself. She's also more emotionally reactive, which makes her more upset, angry, and anxious, and less motivated while doing so. She does have a personality change, which is similar to the characteristics of borderline personality disorder. She is also more impulsive now with poor judgment and a lack of awareness for safety. For example, she has wandered into other people's rooms to try to get into bed with them. She still has difficulty with sequencing and remembering the steps of tasks that are more than 2 steps. And she still has poor coordination and balance. That makes it difficult for her to walk without some assistance. Now, based on this case study, I came up with 5 goals that I think would be perfect for Megan to help aid in her recovery towards independence. My first one is that I said, in 3 months, Megan will walk independently and will attend her school's prom without the use of a wheeled walker. The second one is that in 2 weeks, Megan will be able to perform self-care tasks independently by using modified and adaptive equipment in her bathroom. So this would include like rails or chair seats or anything to help with transfers. The third one is that in 1 month, Megan will be able to take strolls around the local park with minimum assistance and verbal cues regarding safety, mental mapping, and judgment. My fourth goal is that in 6 weeks, Megan will return to school with minimum assistance in sequencing, emotional regulation, and verbal cues for impulsivity while doing her schoolwork and sitting in class. My fifth goal is that in 3 weeks, Megan will attend, but not necessarily participate in, either her school soccer, gymnastics, volleyball, and horseback riding practices at least once a week, with verbal cues for safety and impulsivity to practice socialization and allow her to still feel included. Based on these goals and her interests, strengths and weaknesses, I came up with 3 activity and intervention ideas which I feel like could really help Megan become independent and help work towards her goals. My first one that I thought of was horseback riding or hippotherapy. So horseback riding is already an activity that she is familiar with and interested in. So it should be an intervention that she will find meaningful and will be motivating for her to build up some more strength and confidence in her physical abilities. Being in a hospital and being unable to walk will cause some muscle deterioration in her whole body. Being on a horse will allow her to practice muscle strength, endurance, and stamina, since she will have to practice with her core, legs, back, and neck muscles in order to stay upright on the horse. All these muscles are necessary for her to walk independently without her wheeled walker, and the activity is something that she will enjoy while also working on those goals. The second intervention and activity that I thought of was yoga. So although she did not necessarily express interest in yoga specifically, she did express interest in gymnastics and other active sports and activities. So due to her background in gymnastics, one can assume that she was a semi-flexible athlete. Yoga will allow her to work on that flexibility and may also remind her of some warm-ups that she would have done in gymnastics. Yoga will also allow her to work on more strength to assist in her walking and with some transfers. This will also allow her to practice some emotional regulation techniques for when she does get angry and anxious. The third intervention and activity that I thought of for Megan was doing some crafts, because who doesn't love crafts? So the other 2 activities that I thought of were already very physical activities, since we were doing hippotherapy and yoga. So I wanted to include an intervention that isn't as physical, so that she does not get exhausted and worn out or sore or tired or anything of that nature. We wanted something where she could be stationary and at peace. So by utilizing crafts as an intervention, she will also be practicing sequencing skills, since that is also an area that has been greatly affected. The crafts do not have to utilize too many tools or materials, but can be based off whatever the facility already has. The crafts can also easily be graded based on her cognition and sequencing skills, and can be made more difficult as those skills increase later on. She will also receive satisfaction and pride based on what crafts she finishes, and can easily gift them to her friends and boyfriends, since she expresses that she misses them. Alright, so I'm going to take a short break and I'll come back to you and demonstrate some perfect yoga poses that will be great for her to do some walking and transfers and any other strengths. And I'm back again to demonstrate some yoga poses for her treatment exercises in order to strengthen her legs to help her with some balance and coordination when it comes to independent walking. So just to keep in mind, I am not a professional yogi nor yoga instructor or very good at yoga anyways. So these poses are based on what I have researched and come up with. But again, do not take this as I am doing any sort of education or anything. I'm just demonstrating what the intervention would look like. So the first pose I found for strengthening legs for balance and coordination was the classic chair pose. I will demonstrate that now. Okay, so standing straight up, you would stick your hands straight up in the air, bend slightly forward, and then sit back like you were sitting in a chair. Again, this helps with the glutes, thighs, knees, everything, while also strengthening the core and back muscles and working on some balance and coordination, since you have to find your center of gravity. The next pose that I found is the leaning crescent pose. So it's very similar to the chair pose that I just demonstrated. However, the legs will be slightly further apart to help with some more balance and coordination, but will also be strengthening the legs in the process. So again, you would stick one leg forward, body straight over the center of your hips in between the two legs. The arms will go up straight in the air, slightly bend forwards, and bend that front foot so you're leaning forward like this. But the back leg should be going straight in line with your back. And again, that helps mostly with the thighs, some back and core strength, while also just some balance and coordination in general. Another great yoga pose is the standing frog pose. So again, you'll stand straight up, and this one's slightly different than the other two I showed you. You will externally rotate your hips about a 45-degree angle on both sides. Bend your knees, make sure your knees are facing over your toes. Hands together, slightly bend forward. Get down deeper if you need to. Again, that's being graded. You can go as deep or as high as you want to. And this helps strengthen the inner thighs, glutes, all of your thighs in general, as well as keeping the strength in your core and back. Again, to help with some balance, endurance, coordination, all that, which is perfect for walking. The last pose I have is not as much for strengthening legs, but I think it's good to get a good stretch in there as well, since we will be doing a lot of strength in the legs. So this one is called the wide-legged forward fold. So you would start standing. Again, you spread your legs apart, body right over the middle of your legs. But this time you'll face your feet forwards and just bend over. So for this, you get a nice stretch in your hamstrings, and it just helps work out and stretch out all of those muscles that we just worked to strengthen. Alright, so just to wrap things up, do keep in mind that whenever you're doing yoga poses, especially with someone who is not independent in walking, and I do not necessarily know the range of motion or how strong her leg muscles are, this could be done holding onto a chair, holding onto anything sturdy or stable to make sure she doesn't fall. And make sure you take some safety precautions when it comes to that, and modify these yoga poses for whatever works for her and is also safe.